Chale, moving on to the next triangle, coming to the anterior triangle, and in the anterior triangle, let's deal with this carotid. In the roof of carotid triangle, what structures will be there in the roof? Again, we don't have to draw it. We just we can easily imagine those structures which what will be there in the roof. So roof of the carotid triangle is again having the skin. There will be superficial fascia. There will be the platysma muscle. There will be one nerve which was coming forward, guys. What was the nerve coming forward from the posterior triangle? That was the transverse cutaneous nerve of neck. Transverse cutaneous nerve of neck. And when you look at all these structure, the muscle there is platysma in the roof. What is the nerve supplying the platysma? Platysma is supplied by facial nerve. Which branch of facial nerve? Cervical branch of facial nerve. So when facial nerve divides into the 5 branches, it's the cervical branch of facial nerve which goes to supply the platysma here. So that is also coming in this roof. So not only looking at the platysma, you're also looking at the nerve supplying the platysma, and that is the cervical branch of facial nerve. So these are the structures which you expect to see in the roof of the carotid triangle. Nothing to draw. Skin, superficial fascia, muscle is platysma, and its nerve, that is the cervical branch of facial nerve, and the nerve which was coming from the posterior triangle and coming forward, that is transverse cutaneous nerve of the neck. They can always formulate a question like this, that what is the common nerve present in the roof of both the triangles, in carotid and posterior triangle? So the answer is transverse cutaneous nerve of the neck. So that's why I said in the beginning that knowing all the triangles of neck together simultaneously is very important. Floor. Floor. Again, I want you to understand the floor rather than mugging up the name, guys. The floor, when you think of the floor, think of the two bony structures. If I just roughly sketch the triangle for you, this was the posterior belly of digastric. We got superior belly of omohyoid, and this is how the sternocleidomastoid was there. So this is just a rough representation of the carotid triangle. You already know the muscle: posterior belly of digastric, superior belly of omohyoid, and sternocleidomastoid. You already know that these two muscles, they have something to do with the hyoid bone. So that means hyoid bone will be projecting toward this triangle, 1. And what do you expect? What skeletal structure you expect to see below hyoid bone is a thyroid cartilage. So here somewhere, let us say you will see thyroid cartilage. So the part of thyroid cartilage will be seen in this triangle. There we go. Now this is going to be very helpful for us. The hyoid bone, and this TC is for thyroid cartilage. Because when you look at these two bony or skeletal structure, you can manage to remember the muscles which are forming the floor of this triangle. If hyoid and thyroid is there, so obviously the membrane between them and muscle between them will be there. You know that, guys. What is the membrane? Thyrohyoid membrane. The membrane is thyrohyoid membrane. And what is the muscle in between? That is thyrohyoid muscle. Let's keep writing it here. So the first thing that you will see in the floor of this triangle is the thyrohyoid membrane and muscle. Thyrohyoid membrane and muscle. Again, just think from the skeletal point of view. You're looking at the hyoid bone. Now, which muscle you expect to see coming from the hyoid bone and going above toward the tongue? The muscle which will be coming from here and going toward the tongue, guys. The muscle will be called as hyoglossus. So there's a muscle which is again clinically very important from the relation point of view. The muscle which will be going above toward the tongue after crossing the triangle above, that muscle will be the hyoglossus muscle. So you expect to see that muscle also in the floor. So we already got hold of two muscles, thinking of the hyoid bone and thyroid cartilage. Well, what else? Hyoid bone, especially the greater cornua of the hyoid bone, guys, it is giving the lesser cornua and the stylohyoid ligament which is attached to the hyoid bone. It gives origin to one of the constrictor muscle, and that is a middle constrictor. So we'll be discussing these constrictor muscle in the pharynx, but you can just, for now, you can note down that middle constrictor muscle is having origin, a major origin coming from the hyoid bone and also from the stylohyoid ligament. So the muscle that will be like surrounding the pharynx, like the middle constrictor will be there. If this is middle constrictor, obviously below middle constrictor, We have what? Inferior constrictor. And which part of inferior constrictor come from thyroid cartilage? The so-called thyropharyngeus part. Remember, inferior constrictor is having two parts. One is thyropharyngeus, one is cricopharyngeus. So the thyropharyngeus part of inferior constrictor, or simply let's say inferior constrictor. Simply let's say inferior constrictor. So the two constrictor muscle which will be seen in the floor, one is the middle constrictor, and here we have inferior constrictor here. So these are the structures present in the floor: hyoglossus muscle, thyroid membrane and the muscle, inferior constrictor muscle, and the middle constrictor muscle. So these are the one in the floor here, along with the hyoid bone and thyroid cartilage. See, there are certain mnemonics for everything. I don't know, but there must be a mnemonic for the floor of this triangle. But I'm sure that you must be fed up of the mnemonics by now already. There are so many mnemonics in other subjects as well. So if even though we're investing more than the time needed just to understand the triangle's floor of this particular triangle, which could be done in like a couple of seconds only, but this is good for the memory. This is something which you don't probably have to revise. You just have to understand that we think of carotid triangle, think of hyoid bone, think of the thyroid cartilage, and then you think what muscle will be there in that region. Muscle in between is thyroid, muscle going above to the tongue is hyoglossus, behind we have middle constrictor from here, and obviously inferior constrictor we all know originates from thyroid cartilage. So that's about the floor. From the floor, now guys move on to the contents. Contents of carotid triangle. We have a fair idea about the contents already. We know about carotid sheath. We know about the branches of external carotid artery. We know about vagus nerve. So we have a fair idea about the content. It's just that we have to put them together, and automatically you'll keep on remembering more and more contents when you draw it. So I'm going to go with the boundaries again here. Let's say this is the sternocleidomastoid. If you go, this is the sternocleidomastoid forming the posterior boundary of the triangle. The superior belly of omohyoid. This is posterior belly of digastric first, and then we have superior belly of omohyoid here. Posterior belly of digastric, superior belly of omohyoid, and sternocleidomastoid. Okay, what content we expect to see inside? Obviously, carotid triangle. So carotid sheath and its content will be there. So when you think of carotid sheath and its content, so what comes to your mind is that we got this carotid sheath which will be going above also. That carotid sheath is extending down in this triangle. That's carotid sheath, right? What is the content of the carotid sheath? We got a common carotid artery present inside. And then we said that common carotid artery will continue as internal carotid artery within the sheath. That's internal carotid artery continuing above. And external carotid artery will come out of the sheath like this. The external carotid artery will come out of the sheath. Just to make it more obvious, the vein inside, that is internal jugular vein. So there we go. This is the internal jugular vein to be seen. And of course, the nerve which is sandwiched between the two, that was the vagus nerve. That's going to be the vagus nerve. So I can see the carotid sheath and its content clearly. Carotid sheath and its content can be seen. Let's label it, guys. This here is the carotid sheath, and I'm telling you, when you draw it, you're gonna remember a few more contents there. I'll tell you why. How? The nerve which is inside here, that is the vagus nerve. We have discussed the vagus nerve in the transverse section in the investing when we saw the deep cervical fascia. This is internal jugular vein. This specifically is the internal carotid artery, and the one below here is the common carotid artery, and obviously carotid body and carotid sinus will be there inside. and this here is external carotid artery. Now, external carotid artery may not be the content of the carotid sheath, but yes, it is the content of carotid triangle. Of course, it is there in the carotid triangle. And by looking at these content, we can fetch more contents here. Like we have these contents, mainly if we talk about broadly, we talk about. Then there is a nerve which you see, which is running behind like this. It pierces this carotid sheath in the upper part, and then will be running like this and coming here. That was the spinal accessory nerve. We already discussed, guys, spinal accessory nerve is the content of posterior triangle. Posterior triangle is here. But how it is coming in the posterior triangle? It is coming from the carotid, and in the carotid, it is coming from the triangle above, that is digastric. So the spinal accessory nerve is piercing this carotid sheath in the upper part. It is piercing this carotid sheath in the upper part, comes into the carotid, and then goes into the posterior triangle. Continuity is important. They might ask you that spinal accessory nerve is contents of what all triangle. And they might even ask you that what is the sequence, looking at the new pattern question. So what is the sequence? First is in the digastric, somewhere there, then comes into carotid, and then it comes into the posterior triangle. And another nerve which is piercing this carotid sheath and will be seen running there. Once again, the nerve that you see running here, coming in this triangle and then going forward. I'm just drawing a very small part of it. Purposefully drawing it thicker, guys. This is so that you can appreciate this nerve. This nerve here is the hypoglossal nerve. Hypoglossal nerve. Again, you can see it is starting from there. It is like first piercing this sheath, coming into what triangle? Carotid triangle, and going back to digastric. It is going back to the digastric triangle. So 3 nerves, 10, 11 and 12. Last 3 cranial nerves are seen in this triangle. 10, 11, 12. Carotid triangle is having 10, 11 and 12 nerve as a content. Let's write them together before we see look at a picture to identify those structures there. Let's write them together. So starting with, we said internal jugular vein is there. Let's write all the contents, guys. Internal jugular vein is there, number 1, of course. Then we got a common carotid artery. We got internal carotid artery. We got external carotid artery. Now, external carotid artery, along with that, I should write the branches of external carotid given off in this triangle, something we have already discussed. So what are the branches of ECA? What are the branches of external carotid artery given off in this triangle? 5 branches, which goes like superior thyroid artery, lingual artery, facial artery, ascending pharyngeal artery, and of course occipital artery. Occipital artery, which then goes into the posterior triangle. Right? Justified till now? Okay. Nerves, what nerve we just saw? We have 10th nerve, 11th nerve and 12th nerve present inside. 10th, 11th and 12th nerve. Now, does this nerve remind you of something? When you look at the 10th nerve and 12th nerve, they do remind me some more content. And that's why we said that discussing the cranial nerve initially is of benefit. Guys, 10th nerve will give off the superior laryngeal nerve, and superior laryngeal nerve divides into external laryngeal and internal laryngeal nerve, which also will be the content of the same triangle. We are not drawing it, otherwise it will become too cluttered there. So vagus nerve is there, a branch of vagus nerve called as the superior laryngeal nerve coming in here, and you know the 2 branches of superior laryngeal nerve, external laryngeal and internal laryngeal, will be seen. If you're looking at hypoglossal nerve, then I can also think of something which is related to hypoglossal nerve, and that was ansa cervicalis, which is also forming the anti-relation of carotid sheath. But if these contents are there inside, internal jugular vein and all these, if these are there, so of course I can add carotid sheath as a content. Carotid sheath obviously is a content, and the relations of carotid sheath will also be the content. One relation of carotid sheath which is in relation to the hypoglossal nerve is descendants hypoglossi, or let me just simply write ansa cervicalis. A part of ansa cervicalis will be there related to it. And posterior relation of, what was the posterior relation of carotid sheath? It was sympathetic chain. If you remember, sympathetic chain was the posterior relation of carotid sheath. Sympathetic chain was the posterior relation of carotid sheath. So with that, I'm able to justify the contents of the carotid triangle, because I know that if that particular structure is there, related to that structure will also be there in it. Carotid sheath and its content, external carotid artery with its 5 branches, 10, 11, 12, last 3 cranial nerve, branch of vagus nerve that is superior laryngeal, giving off the 2 more branches, external laryngeal and internal laryngeal. We see ansa cervicalis, and we see the relations of the carotid sheath on the posterior side, that is sympathetic chain. All this comes under the content of carotid triangle. Let's decipher these contents in the picture. The same picture that we use for the posterior triangle, I want you to use the same image here. And this time we'll be looking at the carotid triangle here. There we go. Just let me rub these off these. And let's pay attention only to this triangle, guys. Let's pay attention to this triangle. So the few structures are very, very easily identifiable there. Like you can see the internal jugular vein there. I'm going to write them in very, very short. This is I is for the internal jugular vein, right? This here is C is for common carotid artery. We have continuation which is going on. Look at this common carotid artery continues as internal carotid. But look at the one in front. This is external carotid artery with 5 branches. Let me point out the branches to you. This branch of external carotid artery is superior thyroid artery. Can you see that artery? It's the first branch of external carotid, goes down, goes deep to the strap muscle where we have thyroid gland. So that's a superior thyroid artery. Look at the second artery here, which is going above in the triangle, deep to these muscle and to the tongue. That is a lingual artery to be seen. That is lingual artery. That over there is a lingual artery. You can already see a facial artery. Can you see that facial artery in relation to the masseter muscle? That's the facial artery. That facial artery is also coming deep to this muscle from this triangle only. So I cannot appreciate the origin there. That's kind of hidden in. But yeah, even the facial artery begins in that triangle only. So let me write the name here. That is a facial artery. And you can clearly see one artery which is going on the posterior side. That is the occipital artery. 5 branches of external carotid are in this triangle: superior thyroid, lingual, facial, occipital, and the one which you can't see is ascending pharyngeal, because we said ascending pharyngeal is a medial branch. It is on the medial side. I can't see it. The nerve present between the internal jugular vein and common carotid, that is the vagus nerve. Look at that. Can you see the vagus nerve there? This here is the vagus. The nerve that you see which is running backward and coming into the posterior triangle, that is spinal accessory nerve. Look at that nerve. That's a spinal accessory nerve coming in here, going deep to the sternocleidomastoid, supplies it, and then ultimately can be seen here also. We already marked it here. That is spinal accessory. And I hope you can appreciate that nerve passing superficial to the carotid vessels. That is what? Hypoglossal nerve. You can see hypoglossal nerve is going into the triangle above. We'll see that again later. This here is the hypoglossal nerve. And look at the descending from the hypoglossal nerve, that is descendens hypoglossi. Guys, look at my marker here. That's a descendens hypoglossi coming down. Look at that. That's descendens hypoglossi. And this one here is a descendens cervicalis. And they together will make a loop which is called as ansa cervicalis. I cannot appreciate the loop right now because it is covered by the sternocleidomastoid. But at least I can see the descendens hypoglossi, and I can also see the descendens cervicalis here. Sympathetic chain will be there on the posterior side. I cannot see it from here. But majority of the contents can easily be appreciated if you have knowledge in a schematic diagram that there is a carotid sheath. We got the contents of carotid sheath, that is internal jugular vein, common carotid artery, external carotid. 5 branches, out of which 4 can be appreciated in the triangle. 1 is hidden. 3 nerves, 9, 10, 11. 10, 11, 12, sorry. 10 is in the carotid sheath only. 11th is going backward and 12th is going forward. And then also about the relations of the carotid sheath, that is ansa cervicalis is in the front and the sympathetic chain is deep somewhere. Cannot see it in this picture. So even if it is a cadaveric image, I don't think there is any difficulty in identifying the structure. One structure aids in identifying the other. So if you can identify, let's say, external carotid artery, then you can trace the external carotid and look into the branches. Which direction are they going in? Are they anterior branches? Are they posterior branches? So what I'm again emphasizing on that, it's imperative to know about the nerves, blood vessels and the fascia even before we think about discussing the triangles of the neck. So with that, we're done with the 2 major triangles here. One is carotid and one is the posterior triangle. We're going to discuss one more triangle here in a detailed part, that is this triangle, that is digastric triangle. But our focus in the digastric triangle is in one of the major muscle on the triangle, that is the hyoglossus muscle. That is the main reason here. So we'll be approaching this digastric triangle in a different way, not discussing the mainly in a generalized way, like not too much bothered about the boundaries and the roof and the floor. We are mainly have to look into the relations of hyoglossus muscle. And why hyoglossus relations are so important? Because submandibular gland and its duct, Wharton's duct, are present on that muscle. So again, that makes it surgically important here. So in the series of the triangle, let's go to the next one, and that is the digastric or submandibular triangle. Okay. So this was the mandible. Let's say this is the mandible here. We got the external auditory canal, the mastoid process, and the occipital bone. Once again, I'm just looking at the upper part of the triangles of neck. You got the hyoid bone, let's say somewhere here. So boundary, anterior boundary is by what? That is anterior belly of digastric. Well, you already saw that. That is the anterior belly of digastric. Now posterior belly, posterior boundary is by two things. One is the posterior belly of digastric, which is like coming like this. This is posterior belly of digastric. And there's another muscle coming from the styloid process to the hyoid bone, that is stylohyoid. So above, you can draw one more muscle there, which is also coming to the hyoid bone, that is the stylohyoid. In the nerve supply only, I've told that posterior belly of digastric and stylohyoid, they have a different origin, but then their nerve supply, their blood supply, the triangles they are present in there, that is almost everything is same. So this here is the anterior belly of digastric. This is posterior belly of digastric, and this is the stylohyoid muscle. Base of this triangle is by the base of mandible here. You can say upper boundary or base is by the base of mandible, and then you can imagine a line which is connecting the angle of mandible to the mastoid process. Just you can imagine a line connecting the mastoid process and angle of mandible. So this is the triangle that we have inside. What other muscles we expect to see here in the floor? In the floor, what muscles are there? One muscle was muscle forming the oral diaphragm, and that muscle is mylohyoid, guys. Look at this. If you're drawing it with me, drawing this way, there's a mylohyoid muscle there. Mylohyoid muscle. It is coming from the hyoid, mylohyoid line of the mandible. We call it mylohyoid muscle. And then muscle that you remember coming from the hyoid bone and going to the tongue, make sure this muscle is passing deep to the mylohyoid. This is hyoglossus. I'm going to show it to you in the picture also. This muscle is hyoglossus. Hyoglossus. The constrictor which was there related to this one, what constrictor was that? That was a middle constrictor. So this area is heavily occupied on the posterior side by the middle constrictor also. Middle constrictor also. Even we have in the upper part, we do have a contribution from the superior constrictor as well, but mainly it's the middle constrictor muscle that you have. So in the floor, one is mylohyoid muscle, which is placed superficially. In the floor, but superficial, there is mylohyoid. This muscle here is what? That is the hyoglossus, the most important. And more posteriorly, in this part, we will be having the middle constrictor muscle. Middle constrictor muscle will also be there. So if I have to say the three main muscle forming the floor: mylohyoid, hyoglossus, and middle constrictor. And that's the way also they're arranged. I mean, you have mylohyoid more superficially placed, and the hyoglossus is more deep to mylohyoid. So it is going deep to the mylohyoid. Makes sense also. See, hyoglossus has to go to the tongue, and mylohyoid to the mandible. So obviously, what is outside? Mandible is outside. So this muscle is more superficial, and the muscle which is going to the tongue is more deeply placed here. And because hyoglossus muscle is having the submandibular gland present on it, the relation of this muscle becomes extremely, extremely important from the surgical point of view. So guys, we will be approaching the content of this triangle from this muscle point of view. that what structures are superficial to hyoglossus, what structures are deep to hyoglossus. Then we look at mylohyoid, what structures are superficial to mylohyoid, what structures are deep to mylohyoid. But I wanted to understand few things here already, because mylohyoid is superficial and hyoglossus is deep, which you can see in this picture also. Let me again just take you back to this image. Look at that, guys. If you look at this picture here, this muscle here is mylohyoid. The one which I'm highlighting here for you is the mylohyoid muscle. That is mylohyoid. And more deep to mylohyoid, which cannot appreciate very well inside, the muscle deeper inside is hyoglossus. That means any structure which is present superficial to hyoglossus, can you see some nerve and all that? Any structure which is superficial to hyoglossus is automatically present deep to what muscle? Mylohyoid. All the superficial relations of hyoglossus are going to be the deep relations of mylohyoid. Whatever nerve or blood vessel they will go in front, they will be deep to mylohyoid. Right? And then we have some structures superficial to mylohyoid, and we have some structures deep to the hyoglossus. Collectively, all of them are present in digastric triangle. They all are present in the digastric triangle. So let's approach this triangle from the hyoglossus point of view. So we are going to discuss the relations of hyoglossus. And in the first go, we are talking about the superficial relations. First, let's look at the superficial relations. So to understand it, let me draw this hyoid bone and muscle individually. Here we have the hyoid bone. This is the greater cornua, and let's say this is the lesser cornua of hyoid. There we got the hyoglossus muscle coming from the greater cornua and going toward the tongue. That's the tongue here. So please draw it with me. This is the hyoglossus muscle, mainly starting from the greater cornua of the hyoid bone, ascending upward into the digastric triangle and ultimately reaching the tongue. Hyoglossus. So in this picture here, we are looking at the superficial relations of hyoglossus only. What are the superficial relations? One muscle, starting with a muscle only. There is a muscle which is passing superficial to hyoglossus, and that muscle is merging with the hyoglossus, and again a muscle of tongue only coming from styloid process, guys. What muscle is that? That muscle is styloglossus. So you will see the fibers of styloglossus from the styloid process. They will come superficial to this muscle, merge with it, and obviously goes to the tongue. That is the styloglossus muscle. Just below styloglossus, you will see a lingual nerve. We all know that lingual nerve supplies anterior 2/3 of tongue. So lingual nerve will be seen running in. Passing superficial, there is lingual nerve. And if lingual nerve is seen, which ganglion is also to be there, guys? What is the ganglion to the lingual nerve? That is a submandibular ganglion. So connected to lingual nerve, you will also see this ganglion here. That is the submandibular ganglion will be seen. Below that, you will see submandibular gland. And which part of submandibular gland? Deep part. Superficial part is even more outside. It's a deep part of submandibular gland which goes here. Superficial to hyoglossus. I'm saying superficial. Superficial to hyoglossus, although it is superficial to hyoglossus, but this is a deep part of submandibular gland. This here is a deep part of submandibular gland. This here is a deep part of submandibular gland, and coming from the deep part of submandibular gland is the submandibular duct or Wharton's duct. And if you look at Wharton's duct, it starts like this. It goes above, it winds around the lingual nerve to open in the floor of mouth. That's how the Wharton's duct is present. This is submandibular duct or Wharton's duct. Submandibular duct and Wharton's duct. And again, guys, this relation is, again, you can understand why it is important. If there is a stone in the Wharton's duct, and if you're trying to remove that Wharton's duct stone, then the nerve you have to be very, very careful about is the lingual nerve. Because injury to lingual nerve at this point here, is not only to injury to lingual nerve, it is also going to be the injury to the chorda tympani, because chorda tympani joins the lingual nerve on the posterior side here itself. So having injury to lingual nerve here is not only going to cause the general sensation loss, but also the loss of taste sensation as well. And finally, below gland and the duct, you will see another nerve which is supplying the tongue muscle. That is the hypoglossal nerve, is also to be seen running superficial to hyoglossus. How important this duct relation is now. Above and below, look at this. Above we have lingual nerve and submandibular ganglion, and this lingual nerve is very, very closely related to it. And below we have hypoglossal nerve. If the injury is to hypoglossal nerve, tongue paralysis will be there. If the injury is to the lingual nerve above, the general sensation and taste sensation from the tongue will be gone. And that's why this relation is important and you need to know about it. So these structures are present superficial, guys. Styloglossus muscle, lingual nerve, submandibular ganglion, deep part of submandibular gland with its duct, and hypoglossal nerve. Now question is, what contents or what structures are present deep to hyoglossus? Now we already said whatever is present superficial to hyoglossus, they are all deep to what? Which muscle? Mylohyoid. Mylohyoid muscle will be covering it from the outside. So all these structures are present deep to mylohyoid. So I can just add a statement here. Superficial relations of hyoglossus are deep relations of mylohyoid. Superficial relations of hyoglossus are deep relations of mylohyoid. So what are the deep relations of hyoglossus? What is deep to hyoglossus? More deeper. Again for that, deep relations of hyoglossus first. What are the deep relations of hyoglossus? For that, again, I request you to just draw the hyoid bone with its two cornua, the greater and the lesser. You don't have to draw this diagram as big because there are only 3 structures to be shown there. And let's say this is the hyoglossus muscle once again. We already saw the superficial relations. Now we are looking into the deeper relations. What deep relations we got, guys? From the styloid process, if this is a styloid process, let's say, we saw one muscle that was styloglossus. Now styloglossus muscle was coming like this and superficial to this muscle. Superficial. But the ligament which will come from here, stylohyoid ligament, will go deep to this muscle and then goes toward the lesser cornua of the hyoid. So we got a stylohyoid ligament which is stretching like this, going deep. That's why I'm drawing it dotted there. It is present deep. One. Second thing, the nerve that you see passing deep to this muscle is the glossopharyngeal nerve, 9th nerve. We saw hypoglossal nerve was superficial. Hypoglossal nerve was passing like this, superficial to the muscle. But 9th nerve or the glossopharyngeal nerve goes deep to the muscle. And artery which is coming from carotid triangle and above like this, and then will keep on moving upward, that's a lingual artery. Lingual artery. These are major three deep relations of hyoglossus. Lingual artery is again divided into different parts, guys. Like we have a part of lingual artery proximal to hyoglossus. The second part of lingual artery is deep to hyoglossus. And third part of lingual artery is the one which is going toward the tongue, that is distal to the muscle. So lingual artery is also divided based on this muscle only. So stylohyoid ligament, glossopharyngeal nerve and lingual artery are the deep relations. So till now what we got? We got the deep relations of hyoglossus. We got superficial relations of hyoglossus. Superficial relations of hyoglossus are deep relations of mylohyoid. So the only thing left is superficial relations of mylohyoid. Again, we don't have to draw it, we can simply write them. Superficial relations of mylohyoid. Superficial relations of mylohyoid. In fact, I would like to draw it only, and then we can see it in the diagram. Now this time we're looking at a superficial mylohyoid, so I'm going to just draw the mandible here, and this here is the anterior belly of digastric, and that's the posterior belly. Mylohyoid muscle is like this, guys. Just make sure draw the mylohyoid in such a way. You can see it here also. So one superficial relation of the mylohyoid, you can already see that, is this anterior belly of digastric. Anterior belly of digastric is not only forming the boundary of this triangle, mylohyoid is present deep to it, so mylohyoid muscle is kind of overlapping it. If I just talk about mylohyoid, so mylohyoid superficial relation is one muscle, that is anterior belly of digastric. Then superficial part of submandibular gland, guys. We said submandibular gland superficial part is here, and then submandibular gland will turn from this posterior border and goes deep inside. So deep to it was a deep part. Here we have superficial part of submandibular gland. So let's say we have a superficial part of submandibular gland present. Superficial part of submandibular gland is there. Then this mylohyoid muscle is supplied by, if you remember, there was a nerve going inside the mandible called as inferior alveolar nerve and inferior alveolar artery. And we already discussed that those nerves and vessels, before they go inside in the mandible, they give off a nerve which comes down, which supplies this muscle as well as this muscle here. Nerve to mylohyoid and even vessels to mylohyoid will be coming in there. Nerve and vessels to mylohyoid, which also supplies anterior belly of digastric, they're also present superficial to mylohyoid. Three main things, four things I should say: anterior belly of digastric, superficial part of submandibular gland, nerve to mylohyoid, and artery, or you can say vessel to mylohyoid. When obviously some lymph node will also be there. These structures are present where? Superficial to mylohyoid. Superficial to mylohyoid. So with this we conclude the structure superficial to mylohyoid, deep to mylohyoid, superficial to hyoglossus, deep to hyoglossus. And guys, what triangle are we discussing right now? This is all what triangle? Digastric triangle. So everything that we discussed here, they are ultimately contents of digastric triangle only. They are all contents of digastric triangle. Just to conclude that, let me show you one picture. Finally, again, the same picture, and this time I wanted to focus to the mylohyoid muscle. That's mylohyoid. What are the superficial relations? Can you appreciate that this here is what? Anterior belly of digastric. You can see this nerve, that is nerve to mylohyoid. You can see this gland here, that is the submandibular gland, superficial part. Vessel is not shown. If I just draw it, even vessel will be there. The vessel to the mylohyoid will also be there, not shown in this picture. So anterior belly of digastric, nerve and vessel to mylohyoid, and superficial part of submandibular gland. So with that, we conclude the triangles of the neck. As I said, we got to see these triangles only. Submental triangle is just having some submental lymph node present in that region, nothing much. And the muscular triangle is all about the muscle, strap muscle. It's a triangle which is containing the strap muscle. So the three major triangles which you need to focus on is the posterior and carotid, and yeah, little bit about this digastric triangle, especially about the relations of hyoglossus.